lecture, I want to take a look at ethics committees and this uh, policy or practice of whistleblowing. We'll define what that is. I know this was a dip into the chapter 6, but felt important to end a course in healthcare ethics to talk a little bit about these ethical resources and really some guidelines and policies about what happens when there is an ethics violation. So ethics committees have been around for some time. They are made up of an interdisciplinary group. And we've talked about ethics committees briefly in Chapter 2, in Unit 2, in informed consent. They're often used as a resource when the need to find a surrogacy if there's a question about whether a patient can make an informed consent. And so they can be a case by case basis in which they can gather and make recommendations. But your book talks about four principal functions that ethics committees can perform in hospitals and in various healthcare settings. The first is public education. So the professions have a responsibility rooted in their expertise to educate the public about what is good and bad in healthcare. And so, having seen a variety of cases, sometimes they can be a good sounding board in giving some indication of best practices. Usually, ethics committees will contain someone who is a lawyer, has a law background, but they can also include public education around different religious beliefs and how patients might want to be treated given a particular belief set. Second function is writing policies. Ethics committees have more and more had a responsibility of writing policies for their respective institutions or hospitals, and these policies can include everything from advanced directives to confidentiality policies and things like that. Enforcement of the policies can sometimes fall within ethics committees, although we're going to talk about this a little bit more with whistleblowing. This can be a difficult task, and that it requires leadership from administrators and the head of staff. Um, and usually, ethics committees are not standing committees but are called in particular moments. So, to try to enforce policies can be difficult. And I think the last one is connected with that ethics committees as institutional watchdogs. While it is ideal that committees might be able to watch over the operations um, of an institution, it can be challenging to have that type of oversight. As we move into the phenomena of whistleblowing, and we'll just define whistleblowing, although it'll be in an upcoming slide, as publicly denouncing a particular procedure or action that a medical professional has taken. These can be illegal or unethical or somehow impaired practice or actions. And in Code 3.5 of our ANA code, nurses must be alert to and take appropriate action in all of those instances. And so we'll talk a little bit about when to do it and sort of the also the dangers of whistleblowing. But one of the things I wanted to highlight was that nurses also have a responsibility to assist whistleblowers who identify potential questionable practices. And one of the things we know really from research is that whistleblowers can receive condemnation and really blowback for calling out, as you can imagine, others in their field. So the obligation to police, this is certainly part of the profession, and I think we can see this in other professions as well, to police their own members, to protect clients and to protect the public good. Um, the official policies, policing agencies include the State Board for Nursing Examiners, medical boards. But your book notes that this is difficult for a lot of these state boards as they lack the data, the funding, the staffing to really be able to be active watchdogs. There is the problem of secrecy, even when one is designated, we can understand um, the need for confidentiality, but um, we need to talk about where issues have come up for a particular person, and also this obligation to denounce. This arrives both from being a moral person, the general ethical principles of calling out something when it's wrong, but also the special role that is assigned to the healthcare provider in trying to protect the welfare of patients. The law on impaired professionals provides an exemption when the healthcare professional is undergoing rehabilitation. So this could be an issue where a particular doctor or nurse is going through drug or alcohol treatment or other types of rehabilitation. And the rehabilitation exemption is justified as long as patients aren't endangered during that rehab period. So certainly if someone is under the influence of drugs or alcohol and providing treatment, that would be an exception to that rule. Um, the means of protecting the public involve an obligation to police their own ranks, and professionals have a variety of means available. And so we talk a little bit about that kind of chain of command, in which you would note that there is, a particular problem or something that you're seeing that's an issue. In terms of whistleblowing, um, it should be noted that this is sort of a last resort, and we'll see this a little bit more in the next slide. But you want to go through those proper channels. You want to provide a due process when someone is being alleged for a particular violation. And again, we know that when you call this forward, the fear of retaliation can be quite high. Problems with whistleblowing is that medical licenses represent valuable property right and should be guarded by the right of due process. So again, we don't want a situation, a society where a person has studied and trained for a long time and then their license is quickly revoked without a due process and a hearing. Um, we can note that whistleblowing can hurt the credibility and cohesion of the healthcare team and the healthcare profession. But again, up at the top here, anything that violates the rights of the patient or threatens the physical, psychological, or medio-economic well-being of the patient should be considered. And it is important when all due process and evidence has been presented that we step forward. Um, I want to note here that there's particular sensitivity to the views of the general public. But one of the things it noted really in your book is that um, nurses in particular often will be in a state where they will see issues maybe more than most. And so you have to, again, going back to the ANA code, support fellow nurses who do it, but also making sure that, if you see something that's really providing damage, you need to step forward and make that clear. All right, well, that is our last lecture. I look forward to our conversation on the case study.